second insurer in Ohio this week announcing that it is leaving Obamacare and the exchange in Ohio. People in nearly 1 out of 4 counties will not be able to get Obamacare plans as a result next year, in part. With me now, Democratic Congresswoman Marcy Kaptur of Ohio. Representative, thanks for being with me.
Thank you so very much.
So why do you believe this latest insurer and others have left your state?
Well, you know, when they look at what's happening in Washington, it doesn't give one much comfort that the leaders of the country, either the president or members of Congress in his party, know what they're doing. It doesn't create a great deal of confidence. And for Ohio, with the Republican proposal, which basically is over $800 billion in tax cuts and tax giveaways to the richest people in the country, who all have good health plans, all right, taking it away from those who are ill, who are suffering, who are in nursing homes, the disabled, the mentally ill, the elderly, the list goes on. Their rates will go up. And here, sir, what will happen is we will have rural hospital closings, as well as we estimate over 400,000 people or more will lose their insurance, because we've insured about, a little close to 1 million people now under the Affordable Care Act, people who have now had cancer operations, people who have epilepsy and can afford their medicine, senior citizens who are able, because of the Medicaid buy-in in Ohio, to live out their days and months in dignity. This Republican proposal is anti-life. And I can't believe that Senator McConnell, coming from the rural state that he doesn't know this. He's a very intelligent man. So I think that we have a responsibility to the country to put a coalition together to improve what may be shortcomings of the Affordable Care Act, but not to throw the whole thing out and create a tizzy in the country.
So polling shows, though, that folks across America want the fix as well. That's the number, about 46%, I believe, in the latest poll. They want a fix, not necessarily to throw it out or repeal. Yes. That's at least the largest number.
And the president promised that in the campaign. He said that he would allow for coalitions of states to come together. If the state wasn't big enough, for example, some of the smaller states are having trouble with
getting plans. You're talking about being able to buy across lines, across state lines? Is that what you're saying, Representative?
Yes.
Okay.
Yes.
And that's one of the ideas.
Plan.
And theoretically, yes, he's still behind that. And we've seen some on the right and the left agreeing to that solution. But I want to get to get your perspective on a question I was asking the two Johns, and that is, which do you think is better for Democrats at this moment? To go for, if you will, the single payer, the more of the Hail Mary, if you will, or to go with the fixes, which is a Chuck Schumer sort of move?
Well, I think initially we have to go with the fixes. I think small business wants that. I think that certainly our hospital systems, the structure of health care in this country, you can't shake it that much too often. You cause too much damage, and there isn't the certainty. We need to give certainty. And I think if we fix the shortcomings, begin to do that, you can have a public option down the road, you can have a Medicare buy-in down the road, but you can't do it all at once. You've got to take a step at a time. And quite frankly, I think that we have to have competitive bidding for prescription drugs, because so many of the people I represent simply can't afford their medicine. That's wrong.
All right, thank you so much, Representative, for stopping by. Marcy Kaptur, there of Ohio. Great state. Thank you so much, except for that place called OSU. Have a good one.
The Ohio State.
I had to work that in. I'm sorry. All right, talk to you soon. Thank you.